First things first, there are now 19,574 confirmed cases since the beginning of the pandemic of coronavirus in Victoria. That is 41 new cases since our update yesterday. I'm sad to have to confirm that there are now 675 Victorians who have passed away as a result of this global pandemic. That's 9 since yesterday's report. These include 1 female in her 70s, 1 female and 3 males in their 80s, 1 female and 3 males in their 90s. 8 of those 9 deaths are linked to aged care outbreaks. We, of course, send our sincere condolences and our sympathies to each of those 9 families. There are 266 Victorians in hospital. 25 of those are receiving intensive care and 17 of those 25 are on a ventilator. A total of 2,403,388 test results have been received since the beginning of the pandemic, which is an increase of 12,938 since yesterday. They'll be essentially results from Saturday tests, so that's a number that's broadly in keeping with some of our weekend numbers we've seen in recent times. Again, every single Victorian who's got even the mildest of symptoms, please come forward and get tested. It's so important in terms of us tracking where the virus is and then being able to hit the targets that we need to hit in order to safely open up without that risk that we don't have a complete picture and that we're not responding to the virus in the most precise terms. It's very challenging, it's very dynamic, of course, but the more certainty we can bring to this task, then the more reliable the decisions are, the more reliable each of those steady and safe steps are. Any symptoms whatsoever, no matter how mild, please come forward and get tested as soon as those symptoms begin. Stay at home until you get your test result. That's by and large now within a 24-hour period, and it's a massive thing, a massive contribution that each and every person who gets tested is making to the most complete picture of what we're up against. There are more than 190 test sites across the state, and if you've got symptoms and you can't get to a test site, we will come to you. That is so important. There are 4,369 cases in total of unknown source, so mystery cases. That is an increase of 4 since yesterday's report. There are 259 healthcare workers who are active cases, and we send our best wishes to each of them. We thank them for the amazing work that they are doing. The fact they're infected, many of whom will have got it from the workplace, just makes the point that hospitals are high-risk workplaces and this is a wildly infectious virus. There are 1,781 active cases across the state, so those numbers continue to fall, and that is good news. In regional Victoria, there are some 95 active cases in those local government areas under stage 3 restrictions. Again, thank you to every single regional Victorian following the rules, doing the right thing, coming forward and getting tested. These numbers are low and they are being driven even lower because of the amazing work that every single person in regional Victoria is doing, just like those in Melbourne. But when you get to these finer, these smaller numbers, obviously the individual decisions, individual choices become even more important. In terms of Geelong, there are 16 active cases, a decrease of 3 since yesterday, and no new cases. So that's very pleasing given the size of Geelong and some of those transmission risks between the west of Melbourne and Geelong. They are very pleasing numbers. In the show release from this afternoon will provide a 14-day case average for both Metro and regional Victoria, so that I know will be of interest to you and to the broader community. If I could just give you a couple of numbers in, as I always do, in aged care. I don't have disability facility settings today, but as soon as I can provide that, it'll probably be in the show release later today. We have 873 active cases in aged care, 93 outbreaks, and that is a number that's falling in terms of outbreaks as well as active cases. There has been some stability come to residential aged care, and we're very pleased that everyone is working together to drive those numbers down to as low as they can be, given the underlying vulnerability of so many residents in those settings.